right. So, okay. Well, today we'll be talking about the Actionability Clinical Confidence and Culture Initiative at IEC. To get to my next slide. So what this is an action coalition that our organization established in 2001 with the goal of scaling national strategies to engage and prepare clinicians for serving people with IDD. We currently have 22 members of the coalition, 4 self-advocates, 3 care partners, and 15 representatives from clinical professional societies, disability organizations, clinical education organizations, and accrediting bodies. I will say the really underlying goal here is we know that there are so many organizations out there doing great things. PATH-PWIDD is one of them. But where we really see a place for IEC to be impactful is helping to scale initiatives and bring those great initiatives up to prominence so that they can be spread and disseminated more broadly, and then incorporated also into the overarching processes that clinicians go through throughout their careers, via licensing, accreditation, all of that stuff. So we look to not necessarily create new trainings, but elevate those good ones that exist and get them embedded within the healthcare system. Our approach, we use a collective impact framework to develop goals and principles that will shape joint activities for our coalition to do together and for our individual member organizations within the coalition to do within their organizations. We prioritize the perspectives of self-advocates. They are primary, and they are have been involved in every step of this process so far. And our primary focus is on clinicians in the areas of primary care, dentistry, mental health, emergency care, and sexual and reproductive health, as those are the bucket. Everyone has a primary care clinician. Not everybody has a dermatologist or pulmonologist. And so those are the areas that can have very big impacts on people's lives. And those clinicians themselves, their attitudes can help shape the experience that people have when interacting with the healthcare system. So what did we do? We started by creating a journey map to kind of conceptualize what it would take, both internal and external, intrinsic and extrinsic factors, to drive clinicians to feel confident and prepared in serving people with IDD in the healthcare system. We took that draft roadmap or journey map, and we held focus groups with 87 different clinicians, both in training and in practice across different professions, to identify the priority factors that would motivate them. So we met with everyone from nursing to social work, MDs, DOs, nurse practitioners, PAs, dentists. It's quite a wide variety of specialties. And we grouped the clinicians into 5 groups. So those we called converted generalists, who are clinicians that maybe didn't necessarily have formal training in IDD, but throughout the course of their professional careers, they've become really devoted and dedicated to the cause, and they are what we would consider kind of champions in their amongst their peers. The clinical educators is the ones who set clinical education criteria. We had clinicians with IDD as a very important stakeholder in the process. We also met with clinicians of color and what we call unconverted generalists. So clinicians who, again, had no formal training in IDD, but maybe are not, it's not something that's as forefront or present in their mind as what the converted generalist may be. So we were able to get a wide variety of perspectives and inputs into shaping this journey map that we then, and the purpose there is to figure out, okay, if we can tease out what this journey looks like, we can figure out how to impact that journey and how to pull the levers to get more clinicians further along that journey. So what did we learn? We learned that major themes that would kind of help move a clinician along that journey included positive exposure to people with IDD. Some people spoke very highly of, rotations they had, or they had personal connections to IDD, and that was hugely motivating for them. Receiving formal training, as well as improving communication skills. There was also another common theme was the acknowledgement and recognition that clinicians need time to care for this population and to work with this population as they work on their care goals, and shared lived experiences. So, clinicians with IDD were clearly very in tune with the challenges that an individual with IDD may face while going through the healthcare system. But we also felt that, we also heard that message from clinicians of color as well, who, have maybe been at times felt as, an other within their journey in the healthcare system. The other key finding from these focus groups were that there are really 4 key sectors that have the greatest influence in preparing general clinicians, and that can impact that journey map at various points as they move along to becoming more prepared and confident in their ability to provide care for people with IDD. The first of those sectors is accrediting bodies. So those are, accreditors of clinical training programs, facilities, and state licensing boards. Our coalition and IEC itself as, change makers and advocates who can help to build momentum so that these other sectors act. Educational associations, they are the ones who set the criteria for the clinical education that students receive at the beginning of their journeys. So it's clinical schools, academics, researchers, and also educational journals and publications. They also serve as, they guide that kind of curriculum development for the students, but they also serve as resources for education and training materials. And the other big sector, once someone's out of school, are the professional societies. Clinicians tend to get a lot of input from their professional societies that they are a member of. There are a myriad of professional societies out there where people get their information. There are clinical societies, there are healthcare and other hospital professional societies. And the clinicians especially viewed it as a really important kind of peer support group that they rely on as they continue on in their practice. Okay. So I think, so with all that information, we've worked to put together what we call the ABC3 roadmap. Our steering group used a Delphi process to come to consensus on priority goals that we want for each sector, as well as action steps for each sector to do so that we can help move clinicians along that journey map so that more of them are prepared and feel confident in their ability to work with people with IDD. The coalition voted to first focus on clinicians in practice, as that makes up about 90% of the clinical workforce, leveraging that professional society sector. And that's really if push comes to shove, if we need to kind of make decisions on how to prioritize, that's where our priorities will be. And then we started writing all of this up. We've put together an initial draft. The draft for the roadmap is now final, and I believe we sent that out either Friday or Monday, and I think that was maybe distributed to the attendees of this meeting as well. But yes. Yes, thank you. So that roadmap outlines essentially, it's a roadmap for how we get from where we are today to a point where the whole clinical workforce feels confident in their ability to work with people with IDD in the healthcare field. And I will note, we are also developing a plain language version of the roadmap and related materials that's in the works right now. We've engaged a firm, and we're actively working on that translation right now. Okay, that's a lot. So any questions, I can pause there about, any questions you might have on IEC or sort of the purpose of what the roadmap is intending to do before I dive into sharing more about the roadmap itself.
So anyone have comments? Beth, I know you probably do, or Brian?
Not at this point.
This point, okay.
Interested to hear what's next.
Okay.
I have a question.
Sure.
I'm Tyler Reimchisel. I'm a child neurologist and geneticist, but my main work now is as associate provost in interprofessional education at Case Western Reserve in Cleveland. And I'm wondering if you had, as one of the stakeholders who are involved in this process, the AUCD, or specifically the LEND program through the Maternal and Child Health Bureau.
They have been, they're not part of our steering group, but we have had conversations with AUCD, UCLA, and we've worked to include their materials as part of what we're doing right now, which is like looking for all the resources that are out there and compiling them all together.
Yeah, that's great. When I was a member of I directed the LEND through Vanderbilt when I lived in Nashville, and they developed a curriculum for intellectual development disabilities for the learners, which could be formal students, but also practicing clinicians. So they have a whole curriculum developed. It's really more of a repository covering about 30 topics, and they have a national presence. Really, the focus is on education. So I think there's a lot of synergies between what you're doing and the connections they would have nationally. So it sounds like you talked to one of the groups, which is good. There's a national organization, the AUCD, that I think would be really very powerful. This is really exciting work. And so I look forward to, like Brian said, hearing more.
Yeah, that's great. And we can reach out to them as well. So what we're doing right now, so sorry for the scrolling. I'll use my keyboard, not my mouse. And I'll go quick because we don't have much time. So the roadmap truly is a roadmap, in that it lines out those 4 sectors, the goals for each sector, and then what we want them to do to achieve those goals. And the theory is that if they do all of those things, we can start to, shift the gears and change the healthcare system so that we get the training in place. And you can see it a little bit here, but if you think of it in a linear fashion, the sectors it's a little bit staggered how they act. IEC and the ABC3 coalition, we have to start our work first, which is, collecting data and stories and really building that advocacy as well as kind of culture change information so that the other sectors, we can sort of grease the skids for the other sectors to do what we want them to do. So we're really focusing right now on 2 things. The first one I mentioned, I'm kind of building a culture change campaign, and then corralling all of the different resources that are out there so that we can, as we go to the professional societies and the educational associations, we're not just saying we would like you to make this change. We're saying we would like you to make this change, and here are all the tools and resources to do that, and we can help you along the way as you're thinking of, new standards. How can those standards be coordinated across professions, et cetera, et cetera. The next few slides are, a little more detail about each of the sectors. I won't go through them all. I'll maybe touch on professional societies as an example, where, you know, the first goal is we want to see a clinical culture change, so that they can see people with IDD as individuals rather than a medical diagnosis. And as you can see, there's a series of action steps for to take within that sector. So where are we going now? As I jump ahead, we have this roadmap developed. We're seeking endorsement. We think this is a really important movement, and we want to create a splash. So we would like to invite you all to please consider formally endorsing the roadmap through your organizations, or yourself as individuals, and also sharing and distributing the roadmap with other organizations and affiliations that you might have. We're also looking for more partners. You know, this roadmap is the planning phase, and now we're working to execute those steps that we've lined out in the roadmap. And so we would invite and welcome participation from all of you on this call as we try to publicize the roadmap and make a splash with what we're trying to do, but then as we move forward and carry out the work. So I will pause there for any other questions.
Lauren, I have a question. I'm Diane. My name is Diane Cooney-Miner. I'm the executive director of the Golisano Institute for Developmental Disability Nursing. I'm also an accreditation site visitor for the Commission on Collegiate Nursing Education, and have a long history with the American Association of Colleges of Nursing and the development of the essentials documents. So, I appreciate your work, but I'd like to know what representation you have in your steering committee, so to speak, for professional nursing. I mean, I can tell you that Sarah Ailing and Suzanne Smeltzer and I have met with the National Council of State Boards for Nursing over the issue of disability content and licensure. I mean, so a lot of this has been happening. A lot of conversations have been happening. A lot of confrontations have been happening. So I guess I need to know who's representing professional nursing in your work.
So right now we are working with the Developmental Disabilities Nurses Association. They're a member of our steering group.
Yeah, I'm a member of that. Yeah, I belong to DDNA. Yeah, but that's not quite the same as the national leadership that exists around the development of nursing curriculum and licensure and standards of practice. Yes, so DDNA is a professional organization, but does not represent professional nursing at the level of the national level of the United, that we need to be concerned about when we talk about nursing education.
And so as we're continuing to work, in building the coalition and getting the word out there, we are making inroads and trying to get introductions with the American Nursing Association. We have other steering group membership with the accreditation for Council on Graduate Medical Education, and we're trying to get up to the I'm going to blank on the name, but that it's like the interprofessional standards committee that coordinates standards across all different medical professions. So we are working our way through and building those relationships with the broader national organizations as well.
So just an FYI, Suzanne and Beth and Sarah and I are all fellows in the American Academy of Nursing.
Oh, okay.
And I would note that about 30% of primary care these days is delivered by nurse practitioners, not physicians. And so days, while they are PAs, they're physician assistants. There's a lot of primary care being delivered, pretty much depending on the state, directly by physician assistants. So I kind of looked at who was on your steering committee, and it was a bit concerning to me, for your progress in this, that you would have representatives from like the nurse practitioner organizations or the PA associations.
Yep. And
DDNA is it specifically, most of their membership is going to be people who work in community-based agencies, and it's not that they're not all that connected to.
We do have
they're mainstream, but not, they're not connected to some of the mainstream organizations in that way. Go on.
Understood. We do have the American Academy. We also have the American Academy of Physician Associates on our
Oh,
steering
okay.
committee.
You do, okay.
So we have them, and we are looking to include more. So I would love, Diane, you mentioned, if any of you would be willing or able to make introductions to the Nursing Association, we would gladly love to take you up on that and make those connections and inroads there.
And certainly, of course, these days, pharmacists can deliver certain kinds of primary care. I mean, they can do, various kinds of prescriptions, so forth, without any prescription from a primary care provider.
Yep.
And so you have to think about pharmacy as being part of primary care. And for that matter, these days, for many
Social work.
emergency
social work.
department is primary care, and social work as well. Correct.
Yep. That was a message that came through very loud and clear in the focus groups as well. They, it's, if you only focus on the physicians, you're coming in way too late. And so it involves everyone from the schedulers to the front desk reception areas and the nurses, the social workers, and as we have social work representation on our committee as well, and that we wholeheartedly agree with that as we're looking to build out the next phase initiative too.
And I should point out, I mean, I'd like to see you be success. Obviously, we would like to see the professional organizations and the licensing bodies get on board. I would comment that, of course, that in the grant that we have and the way we've approached it is that we are developing a suite of curricular and practice materials that could be integrated, particularly into interprofessional, but that doesn't mean not specific professions, that can be taken up now, in the sense that we're not waiting on AACN, NCSBN, or any of these others to come on board. I would say we're probably more grassroots up in that way, that we're going to do what we can do with the current resources and with our funding. And myself and Diane, Suzanne, Beth, for instance, we've all been very active with trying to get AACN to move to move on the issue without success. But anyway, and I know, Tyler's been involved in things. There are people who are associated with us who've been involved in efforts at various of the professional organizations to get something to happen.
Yeah, and
I would say, your focus is a bit different than our focus. That's not wrong. I'm just saying it's different.
Well, I think, there's, our focus is on, the systemic changes, but as part of that, we'll be creating these culture change campaigns and the training materials and elevating those. And in parallel to that systemic work, we will be putting them together into a training package. And we hope to offer that training through the professional societies and do that as continuing education, ideally free CMEs, so that you can, we're not waiting for the training. I agree with you on that point. You're doing the training now while at the same time working on some of those systemic levers.
Yeah, and certainly, I think Tyler mentioned the issue that there's the materials out of Vanderbilt, which are very useful. There's, I'm sure you're aware, the consensus guidelines in Canada and so forth. There's material out there.
Yeah, the Canadian guidelines. Bill Sullivan is working on updating the Canadian guidelines now. He's no longer at University of Toronto. He's at Georgetown, but we've been talking with him about his work to update the Canadian guidelines in primary care.
Okay, that's great.
Which are, that's well-known, highly impactful work that's been around for quite a while.
Yeah. So we would absolutely want to include that in this work.
And certainly, we have indeed developed a suite of materials over the last 3 years, including particularly simulation scenarios, interprofessional simulation scenarios of both University of Illinois and Villanova. At Rush, we have a service learning opportunity that has involved people from, I think, at least students out of at least eight of the different professional programs. It's essentially, it's a service learning opportunity. The interactions that they have with people with intellectual disabilities are in the range of health promotion, and using also the 4M model out of the aging. What matters to you? We go, what matters to you, and is there anything impact? Anyway, it's basically a health promotion. Certainly, Beth Marks, that for 20 years they've been working on health promotions with Health Matters, with extensive experience on how to work in health promotion. So there's materials. Anyway, we have materials that are already developed.
Yes.
They're
Yep.
with the grant or have been developed historically by various people involved.
Yep.
And with the new special, it's not new, it's been piloted and it's newly updated Special Olympics interactive health curriculum.
Yep, and that's great, and that's what we're looking for. There is so much work that's out there that is great, and we want to elevate that and get that, just help get that disseminated as widely as possible.